Hi, everyone. I'm Cynthia Toussaint at Women in Pain Nation. And today I'm going to do a hot take interview. These are bite-sized conversations with women in pain and pain experts that speak to the lived experience of those of us with chronic pain. So today I am going to talk with the lovely, the talented, and the really smart Dr. Mary Driscoll. Dr. Driscoll is many things. Among them, she is a clinical research psychologist at the VA Connecticut healthcare system and an assistant professor in the Yale School of Medicine. Not too shabby, right? Okay, Dr. Driscoll's work is rooted in understanding gender disparities in pain and its treatment, the tailoring of evidence-based psychosocial pain interventions for this population, the overlap between trauma and pain, and the provision of trauma-informed care. So all of that said, welcome, Dr. Mary Driscoll.
Oh, Cynthia, it's so wonderful to be here. It was such a lovely introduction. Thank you.
And Merry Christmas to you. You look so festive.
Merry Christmas to you too.
Thank you. And I want to just mention that recently I interviewed lovely Dr. Jennifer Pierce from the University of Michigan. I think you know her.
Yes, I do.
You do. And our topic was the connection between childhood trauma and chronic pain. And I want to do this sort of as a second part of that really important conversation. And we're going to get on to the really good stuff. How can, we make things better? So our topic is chronic pain and post-childhood trauma recovery, which I love. So you're just the person to give us all this information. No pressure.
That's right.
Okay. So my first question, it's a two-parter. So for those of us who have experienced significant childhood trauma, and then as a result, I would say high impact pain like myself. So what are some effective trauma release techniques, both with a practitioner, and then the second part is without a practitioner, if you can break that down?
Sure. So that's a great question. And I think first and foremost, I want to clarify that when we talk about trauma release techniques, these are not necessarily things that will release the trauma permanently, right? Trauma is a universal human experience. It's something that we have most people have experienced in one form or another. And what happens is that our bodies can store trauma. And when we experience things in our day-to-day lives that trigger that trauma, our bodies can have reactions or responses that mimic what happened when we first experienced trauma. So when we talk about trauma release techniques, there are some that are sort of temporary that we can use or do to let the nervous system relax. So things like deep breathing, yoga, we can do grounding. Some people like tapping, stretching, anything that you can use for your body or your mind to relax and let go of the physical trauma response. And then there are like clinician-led things that are maybe more akin to some trauma treatments that can help us to release sort of some of the source of the trauma, with the understanding that we may never fully release all of the trauma, and those could be therapies like cognitive processing therapy or prolonged exposure therapy, and those types of things. There are other things that you can do with practitioners. Certainly you can do yoga or deep breathing alone, but you can do those with practitioners as well. So those are the things that I think of, and usually other things target the body, and where the body goes, the mind follows, and we can relax and release that way. And some things target both.
Wow, what a great list of things! I'm making a list. I'm taking notes, and I never knew that you didn't release the trauma permanently. I thought that you did. That's interesting. So,
I guess I shouldn't say that you don't, although it's most people who've experienced trauma in the right or wrong situations will still have a trauma response, right? Because that memory is stored in the body.
Sure. That makes sense. It makes sense, Dr. Driscoll. Yeah.
So please call me Mary. And so essentially when that happens, your body may sort of tense up and take that form. So you may heal from the trauma, but that doesn't mean that your body won't remember in certain situations, almost like an instinctive reaction, if that makes sense.
Right. It does. And I get triggers. I'm like, whoa, you forget. And then, yeah, the body, as you mentioned before the show, our body keeps the score.
So you can heal, but your body may at times still, you find yourself in that, and you're like, oh, there it is again.
Yeah, that same old feeling in my tummy that doesn't feel so good.
Mm-hmm.
A number of those techniques that you mentioned, I have tried. I've also tried, I do mindfulness meditation every day, which helps so much.
Meditation, I missed that one. Yes, very important.
Big one. And then I've done EMDR, which and one eye integration, which is with a practitioner, which were really helpful. And then I do a lot of creative art therapies. I've done talk therapy, but creative art therapies. I'm a singer. I'm a piano player. Narrative therapy helps me.
Yep.
Kitty cuddling, whatever calms me down, as you were saying.
Anything that calms you down. A lot of times integrating some kind of movement or body focused with something that's thought or talk focused. So even talk therapy while you're throwing a ball or, using, that's a little bit of the EMDR is wonderful. I missed that one. Any kind of narrative therapy, those sort of exposure therapies, that has a lot to do with helping you to heal from the trauma, right? So if we make a distinction somewhat from the trauma healing versus the need to release trauma at different times. But yes, you pointed out several that I missed, and I'm so glad that you mentioned, because in whatever way you can relax your body and you can let that nervous system calm, any of that is a trauma release technique.
So this is crazy, but I'm a swimmer. I swim almost a mile most every day. I relax. I feel like that's trauma release when I swim.
Yes.
So how is that? It feels like meditation to me.
Yep. So for some people, so yoga is a moving meditation. And so movement, because trauma is held in the body, and because our memories of trauma are held not just in our minds, but in our bodies, any kind of movement therapy, Qigong, Tai Chi, yoga, swimming, running, anything that is going to help to calm or quell or move or all of those things are effective release techniques.
Wow. Okay, so I just learned a lot, so how do these techniques work, and why do they work? Because they really do work.
Well, if you think about trauma, what happens when someone is traumatized? They fight or flee. They may freeze, or they may take on a pleasing and feel the need to please. Or I don't like the word please. To save
accurate.
But it is.
I was a pleaser. Yeah.
Right. And so we fight, we flee, we sometimes freeze, and then sometimes we try to accommodate, depending on the source of the trauma and our own sort of makeup. We respond to trauma in different ways. And regardless of how you're responding, your body is. In all of the cases, your nervous system is on fire. If you think about it, your heart beats faster, your palms get sweaty, your muscles tense, all of those things are happening. And when we talk about these techniques, all of these techniques are things that reverse that hyperactive nervous system. So if you're moving in a way that is relaxing for your muscles or releasing tension in your muscles. So if you're swimming, you're working them, but you're also releasing tension in the same way that sports and athletics often are stress relievers, right? Trauma is a form of stress. Does that make sense?
Yes. I'll swim a mile and get out and people will say, you must be really tired. And I was like, no, I'm really relaxed. But I didn't know that it was a trauma release method. That is fascinating to me. Yeah. What is trauma-informed care? That was in your bio.
So trauma-informed care, because trauma is a universal human experience, and most people have experienced it in one form or another. Some folks have experienced the things that can lead to PTSD diagnoses. Other people have experienced things like racism, identity-based oppression, rejection, abandonment, significant grief or loss. Trauma is expansive in its definition. And all of these experiences, whether they're traumas that lead to PTSD or whether they're the other types of traumas that I just described, they influence the way we look at the world around us, and they can make it hard for us to engage with healthcare. So, for instance, many people who have chronic pain have felt traumatized by the system itself. And I think
my hand is up.
We were talking before the show about that, right?
Yes.
And so even healthcare stigma is a form of trauma. And so any kind of trauma that you have, if it's interfering with your ability to get and receive care, whether it's because you're feeling stigmatized in the healthcare system, or whether you're walking into a system and maybe you're anxious about being in crowded places. Maybe you don't want a provider to touch you. Maybe you're nervous about the gender of the provider or who you're going to run into in the setting. Anything that can influence the receipt of care and make it harder to access for you, or less effective. We talk about trauma-informed care as an approach to care that acknowledges that individuals coming into healthcare system have a wide range of experiences that can influence their interactions with the system itself and the providers within it. And it's incumbent upon us as providers and the system to understand this and to make the care feel more physically and psychologically safe.
I feel safe hearing this. Individuals are individuals, right?
Right. And if folks come in and they're anxious and triggered, then the outcomes are never as good as if we can help them to feel more comfortable and trust the system and the providers in it to provide quality care.
That's fantastic. Everybody needs to do, really all doctors need to do trauma-informed care. So hopefully we're getting closer to that.
Absolutely.
So on to one of my favorite things. I love post-traumatic growth. I feel like it's a silver lining of trauma. Can you explain what post-traumatic growth, or PTG to have the acronym, what that is?
Yeah, I can try. So a lot of people think about resilience, right? Which is very different from post-traumatic growth. So resilience is a term that's thrown around, and resilience is really helping us to get back to our prior level of functioning, or our prior sort of like your ability to bounce back after something happened, to your maybe pre-trauma or pre-surgery or pre-whatever it was level of functioning. Post-traumatic growth is different from resilience because when we talk about post-traumatic growth, we're talking about positive changes to an individual's well-being that can follow a traumatic event. Now, in no way, shape, or form should this ever be equated to everything happens for a reason, or, that you should find a silver lining. When bad things happen, they're just bad, right?
So no platitudes, right?
No platitudes.
Okay, gotcha.
Absolutely none. Platitudes are not helpful.
No.
There's one of my favorite authors, Megan Devine, always said, some things cannot be fixed. They can only be carried. And so I don't like platitudes when people come in and they try to make, people look at the bright side of the bad side. No.
I like it. Bad things are just bad. Yeah.
Bad things are just bad. That doesn't mean that we can't grow from them. And post-traumatic growth really involves taking a very concerted effort and making a decision, a personal decision to find ways to grow from this. And again, it doesn't just apply to the types of traumas that cause PTSD. It can be any of those other traumas that I mentioned. And it usually involves redefining how you see the world and your place in it, because of course, traumas can make our world seem smaller, right?
And scary and threatening. That's really interesting, because I know just some people who go through trauma and in pain, they move on and it's so wonderful. And then some people get stuck And I was wondering if it can be a goal and if you can learn post-traumatic growth. It sounds like you can.
You can. And you know what? It's just like anything else, because people who have trauma and pain, there's also a grief that comes with losing parts of yourself, right? And so post-traumatic growth for some people may come sooner than for others. Some of us may have more resources to bring to bear. We may have more support, or we may have more socioeconomic resources. And so post-traumatic growth can happen for anyone, but there's not a timeline. And it's really just about redefining how you see the world and your place in it.
Yeah, that makes so much sense, Mary. Grief. Thank you for mentioning grief. I just, gosh, when we lose, you feel, when I got sick, I was a ballerina before, and it was like, who am I if I'm not a ballerina? It was just, took a long time. You made me cry a little bit, because it was like that grief, but it's still there. It's like the body remembers, right?
Yeah, and the grief, and as you move through it, the grief changes. The things that you grieve, the parts of yourself that you grieve.
And that's so interesting.
Yeah, and the other part of post-traumatic growth is it involves change. And we might shy away from things. And so maybe it's figuring out ways to re-engage with the world around us that feel safe. Those types of things.
Right. And we reinvent ourselves, right?
Right. And it could include new beliefs. We may shed parts of ourselves that don't serve us anymore. We may have a greater appreciation for life. Our values may change. And we may hopefully emerge with greater confidence in ourselves.
And then as a result, we might make the world a better place, help animals, or help the planet, or help people less fortunate. And I was kind of
doing with For Grace, provide a safe space for women with
I don't want them to feel alone the way I felt. That was
For Grace is a beautiful example of post-traumatic growth, something beautiful that came out of something awful.
Yeah, it's so well put. So I also just want to mention that I think most people who go through trauma then come out the other end with post-traumatic growth. Am I correct? Or do we have the numbers on that? I mean,
I don't know that we do, because I don't think that anyone measures it. However, I find it very difficult to believe that anyone who's been through anything traumatic, as deep and dark and in the worst places, I find it difficult to believe that there is anybody who doesn't find some way to grow. And again, that is in no way an endorsement or that they should have had to go through the trauma in the first place.
Right. You're not endorsing trauma. Okay.
No, I'm not endorsing trauma. I wish it didn't have to happen.
No, but what a silver lining that people are making the world a better place as a result of trauma. And we have to acknowledge it. We need trauma-informed care. And I just love you. I just thank you so much for this wonderful interview. I learned so much from you every time we talk, and I promise to not ask you to do anything again. Well, actually, I might.
Now you have a blanket yes from me.
Thank you, Dr. Mary Driscoll, so much for your wisdom and your compassion. You are such a special person. I still have your card in my living room, and I look at it every day and think about you. Thank you. And we will talk soon. I really can't thank you enough. I have so much gratitude for you, especially during this time of year. And thank you, everybody else, for joining us here on this Hot Take interview. I have so much gratitude for you as well. What a great Hot Take interview. And in the comment section below, please tell us about trauma release techniques that you've tried, what's worked for you, what maybe hasn't worked so well. What are you going to try after hearing from Dr. Mary Driscoll? And then also tell us about your post-traumatic growth and what are you doing differently? How have you grown and how are you appreciating yourself and as a result the world better? Because Dr. Mary Driscoll and I are just two inquiring minds who want to know. So I'm Cynthia Toussaint signing off for now, Women in Pain Nation, but I'll see you again. And I look forward to it really, really soon. Thanks, everybody. Bye-bye.